tear, it falls and hits the ground. A tree, it falls without a sound. A bird, it calls and sends you home. A man, he sits in the cold all alone.
Hi, Eric. Welcome to the Joy of Sunflowers. Thank you so much for joining me today. Please introduce yourself a little bit more.
Hi, Ella. My name is Eric Atstupenas, and I'm absolutely honored to be here. My wife and I have had a very long journey to become pregnant. Our infertility journey has pretty much taken up most of our 30s, and unfortunately, we still have not brought home a living child. But we're really active members of both the infertility community and the loss community. So I'm happy to be here to share and to offer the perspective of a partner and to offer the perspective of a male. So to the extent I can do that, I'm happy to answer any questions you have, Ella.
Wonderful. Yeah, it's so important as well to get that perspective, because I think often the partner, the male, is just kind of forgotten in terms of, like, you, I mean, you went through it too. You went through that trauma and you went through that loss. So I think it's so great to be able to talk to men and actually have you guys share those stories. So thank you for joining me.
Thank you.
So let's start from the very beginning.
Mhm.
Always want to be a dad, or was it something that you sort of moved towards?
So I would say I've always known that I wanted to be a dad, but I guess I wasn't really sure on the timing of it. So I think my wife and I were on a little bit different paths, timing wise. I think she thought immediately after we're married, we're going to start trying. And I was more like, well, maybe let's hold off for a little bit. Let's, go do some traveling. And then, when we want to start trying, then naturally it'll just occur, right? Like that's how we learn about reproduction growing up, is that, you try and it happens. So I was unaware of the, 1 in 8 families that go through infertility. And so I was more of the, hey, let's just slow our roll, take our time, and get into it when we get into it. But I always knew I wanted to be a dad, and I still really want to be a dad to a living child. And it's still something that's very much a driving force for me.
Yeah, no, it's very interesting when you get that dynamic where there's like, oh, I want one, oh, we can wait, and it's one of
Right.
those things, and obviously in our society we're told you can have kids whenever, especially like as a man as well, like they're like, yeah,
Right.
well, you just keep producing, so you're good to whenever, and I think it really is this misconception that we're sort of trained to believe.
It
um
is.
yeah. So where did you go from there? Like, when did you sort of realize, okay, now is the time, let's try now?
Sure. So we had taken a trip to Ireland, and we decided on that trip we were going to start trying. That was kind of like our first time. And I remember leaving that trip thinking, we've done it. Like, we're going to come back, we're going to be pregnant, and how cool, we will have conceived our child in Ireland, where we both have some roots from our family. So we just thought that was really kind of cool. And then it didn't happen. And it didn't happen month after month after month after month. And then we started trying the different ovulation kits, tried timing it out. And this is something that, as somebody going through infertility, we really don't talk about this a lot, but the excitement of creating life turned into work, and it turned into like a task, and it became tedious. It became trying to time things out and make sure everything lined up. So it takes a lot of the romance out of the process, and it creates a lot of difficulty. And I just remember going through that time and time again, going through each month, not getting the result that we wanted. And finally, we started thinking about, hey, maybe something else is going on. Maybe we need to go talk to a reproductive endocrinologist. And we did. And I remember sitting down and they talked about IUIs, and I was like, okay, so that's how it's going to happen. Great, no problem. And that didn't happen. And I remember there was a conference by Resolve here in New England. That's a great organization that provides a lot of infertility support for fellow couples across this entire region. And I remember sitting there, we we were just starting, we had just kind of started in the IVF journey, and thinking to myself, like, okay, we're gonna be bringing home a living child anytime. Like, it's got to happen. It's got to happen, and that was many years ago. And we kept going the route of IVF. We've bounced around to a couple different clinics. We're in a unique position where my wife has diminished ovarian reserve, and my sperm don't exactly do what they're supposed to do, and they have different morphology and whatnot. So it's a two-factor infertility. So it's kind of hard to say like what exactly is or is not working. So when we do get eggs, we do use ICSI to try to maximize the amount of embryos we get. We just don't really end up getting a lot of embryos. So we've been working with kind of going through this journey for quite a while, trying different clinics, trying to see what works with us, trying to find healthcare providers that resonate with us and are willing to hear us, willing to see us for who we are in light of our journey that we've gone through, and particularly in light of our loss. And so the fight continues. The fight continues to bring home a living child, and willing one of these days we will. So
yeah. How did you get your diagnosis with your male factor, and how have you sort of dealt with that?
Sure, yeah. So I remember several years back, I had to go see a urologist. When we're going through infertility treatments, they're trying to figure out what is it that could potentially be prohibiting or restricting our ability to get pregnant. So I remember them saying, "Hey, you need to produce a sample. We're going to take a look at the sample." And I had to go to a urologist's office for that. And she asked a whole bunch of questions, but ultimately, once she did a study of the sperm, she found that it was just there was problems with morphology, they call it, which is just like maybe they'll have two heads or two tails, or the body doesn't look the way it's supposed to. I joke around and I say they're like goldfish and they just chase their tail and swim around in circles. So they're pretty, but that's my way of dealing with it. From my perspective, as a guy, right? Like, one of the things you think of as a young man growing up is like, this is your part of your purpose, right? And why is it that I can't do this the way that I'm supposed to? And I know my partner's had similar thoughts from her perspective. I have those thoughts from my perspective. And I also have those thoughts from the perspective of like the dad to a child who's no longer here, that I'm supposed to be a provider. I'm supposed to be the protector. I'm supposed to be all those things that Western culture teaches us we're supposed to be, regardless of whether or not that's true and regardless of whether or not that's healthy for us. It kind of throws us into an identity crisis, is what I like to think of, because all of the things that you think you're supposed to do, you're not necessarily able to. And being able to accept that is something that takes some work. It takes a lot of talking. It takes a lot of sharing. It also takes a lot of working with other members in the community and realizing that you're not alone. Like seeing other people wearing the shirts that say 1 in 7 or 1 in 8, knowing that they're going through a similar struggle makes you feel like it's not just me. Because before this journey, we never heard about this before. And that's why I think it's so important. And I really tip my hat to you, Ella, for doing this, because it's so important to have this conversation and to let people know across the world that there's nothing wrong with you. There's nothing wrong. Unfortunately, this is just a crappy journey that some of us have to go through in order to bring home living children, but there's nothing wrong.
Yeah, I think, I mean, I was just talking to Jill about this sort of same thing, in terms of that, we're told that we can have anything as long as we work hard and
Right.
we do all the things, we will get the desired outcome. And, that's simply not the case every time.
No.
And I think, yeah, having that in your head and having it pumped in there, it is like an identity crisis of, well, but I worked hard, but I did the things, but I ticked the boxes.
Exactly it.
Yeah, just drives you crazy. I like the goldfish thing. I think that's a good way of looking at it.
Thank you.
No?
I like it. I like to turn to humor in order to rationalize things sometimes. So that's how I think about it. So,
Exactly. I mean, look, I mean, a lot of the time, this is like a running thing that I say a lot. You know, if we don't laugh, we'll cry. So
right. That's fine.
I've been,
Exactly.
I've been pretty shocked at the things that I've managed to laugh about with people, and yeah, it is what it is. We all
It
kind of
is.
understand each other, and I think that's kind of the beauty and the ugliness of this experience, that we can smile and laugh about things that maybe other people are like, huh?
Mm.
Like, you can't laugh about that. What are you doing?
Sure you can. Absolutely. And I mean, how interesting of a dichotomy is that, right? It's just both so beautiful and so ugly in the same time. And we can hold that space and we can appreciate that. And we can also laugh about some of these things. And we have a few of our fellow lost parent friends that oh my goodness, if people are around, I'm sure I can't imagine what they're thinking when we're laughing at some of the things we're laughing at. But I
Yeah.
mean, you have to rationalize it somehow.
Oh
So
yeah. Yeah. My husband's even like made some jokes and things like about things that you shouldn't joke about, like in normal conversation, and I'm just like, that was terrible. And he goes, I know, I'm not going to share it with anyone. Like, I don't even know where it came in my head from. Like, it's so
it just
bad.
happens. Yeah.
But yeah, I'm glad that we're not the only ones that do that.
Oh
um
no, not at all.
oh, it's terrible. So let's go into your sort of experience all the way up until Hadley, which your wife sort of told me was your child who passed away.
Mm,
So
yes.
yeah, so let's go through the treatments and the fertility stuff,
Mm.
and sort of what that was like. She was saying that you gave her shots. Well done. Good for you. I love it when the dads do it, you know. I'm just like, that's so lovely, you know, because I definitely would be one of those, like, I'm covering my eyes, just don't tell me when you're doing it. Like,
Sure. Yeah. I'm at an unfair advantage because I have type 1 diabetes. So I'm used to giving myself shots all the time. So I was like, oh, fine, I can do your shots. No worries. It's all good.
you know what?
So,
That's amazing, because I was saying to my husband, I was like, I don't know if I would trust you to stick me with a needle,
mm,
but the fact that you already stick yourself, that would mean that would have given her some comfort, you know. She's like,
some.
well, you're successful with your own, so you should be fine with my needles.
I will say I'm very happy with the size of my needles as compared to hers because hers are much, much bigger. And especially once we get into like progesterone and oil, I'm like, I'm sorry, I would have passed out. So I have no problem giving this to you, but this is not something I could take. So just yet another time that as a partner, I'm sitting there saying, yeah, as a dude, I couldn't be dealing with this. So props to all the ladies out there that do this because it is yeah, it's brutal. It really is. It's unfair.
Yeah, so many dads have actually said to me, like, she's the strong one, she's the rock, she, like, yeah. And I've been told that, like, the ones that go in the butt are really big.
They are. They're obscenely huge, and the gauge of the needle is awful, and then the liquid is very viscous because it's an oil. So you really have to press down hard to get the oil in. And from like an anatomy perspective, it's just separating all the little muscle fibers in. Yeah, it's terrible. And then you try to essentially, it's like doing like chest compressions on the butt, trying to smooth out the oil or try to like move it throughout the
Oh,
muscles so it's not all bunched up in one spot. And then she'll sit on a heating pad for like an hour or something. It's awful. It's absolutely terrible. So yeah, I just from the person doing the shot, yeah, greatest respect to my wife. She is like you said. Yes, she is a strong one. I also say she's a smart one, but she's absolutely the strong one. So yeah, nope, I could not go through half the stuff she's going through, a quarter of the stuff she's gone through. So
yeah, no, I don't know if I could do what some of these ladies do. Yeah, I look at them in awe, especially with the shots and stuff. I'd be like, I've had enough now. I'm good.
But it's amazing. I'm willing to bet the same women who do those shots before doing them would say the exact same thing you're saying right now, right? They would say the exact same thing, but they do it and they find that strength. They dig deep and say, I'm going to do this for our family. And just the sacrifice, the willingness to face that pain and the thought of that pain. I mean, guaranteed, I'm guessing so many of them say the same thing, but they do it anyways. So you find the strength, you really do.
I think it's when you've run out of options, because it people think, oh, well, just do IVF. It's usually a last resort, guys. Okay.
Right. Yeah.
Not something you take on lightly, because you know, as soon as you start looking at it a little bit, you're like, wow, this is full on. Like, okay, let's see if this other thing works first, you know. So yeah, but yeah, I can see people saying the exact same thing as me and then being like, well, it's our only option, so we're going to do it. And I think if you feel like you have to do something, you will find some kind of strength to get through it. Yeah, and once you've started the ball rolling, you're like, well, I can't just stop now, because I've gone through all of this already, so I've got to keep going, you know. And you may hate it every single day, but you're still going to keep doing it because you've already started the process. So
yeah, it's such an investment, you know, and especially like with IVF, you get into it and you start investing all that time and energy and resources into doing it. Like, and that's what we did. We started with, you know, IUI and tried that a few times. And then we're like, all right, so we've already kind of dipped our toe into the infertility waters, right? And I was like, all right, I guess we just have to jump in. And the first clinic we worked with, the first doctor was like, she didn't even entertain IUI anymore. She was like, yeah, that didn't work. We're doing IVF. I was like, I thought this was going to be like more of a discussion. And I remember just sitting very confused, sitting next to my wife, looking at her like, are we doing this? Like, you're cool with this? And the doctor's telling her about, okay, you're going to do this, you're going to do that, and this shot and that shot. And I'm just like, I just remember feeling very powerless in a large sense, because I'm sitting here like, okay, we're just moving forward, I guess. And yes, I know like that we want to have a living child and that this may be an option, but I was like, is this where we have to go right now? Like, to your point, like, this is kind of like a last resort. It seems like we're skipping to the end. And they were like, yeah, 2, 3 IUIs didn't work, move on. We need to do IVF. I'm like, okay. And that's such a difficult thing to do emotionally, to say that I need help. I need help to do something that middle school, you know, here, I guess I forgot to say where I'm from. I live in the United States. I'm in Massachusetts. Here, I always joke around that, you know, the extent of our knowledge of human reproduction is limited to like middle school, high school health class, right? And from their perspective, we can get pregnant from like looking at one another, let alone anything else. So, to then learn that I can't do something or that I need help doing something, that alone is its own loss. And that's a huge, huge portion of our trauma and grief process that, for me personally, I don't think I've really started exploring until after losing our daughter. I think I was just so like head down, focused on just keep moving forward, just keep moving forward. And with every failed transfer, it was like, get up, dust myself off, keep moving forward, get up, dust myself off, keep moving forward, and just trying to be supportive for my partner. That I really wasn't processing my own trauma associated with that. So, not to skip forward, but looking back now, we had a transfer after losing our daughter, and that transfer failed, and that's what destroyed me, like from an infertility perspective, because I had not taken the time really to process all of those prior transfers that had failed. And then after spending so much time working with therapy, working with groups, working with my own emotions associated with losing our daughter, it finally just came up, and it was like, wow, this is something that I need to spend some time working on and focusing on, because it's incredibly traumatic to go through, both from the patient's perspective, but also from the partner's perspective as well. And we went through several rounds of IUI, several rounds of IVF, and I've now like lost count at how many transfers we've gone through. I think we just reached 10 failed transfers. So, and my wife will correct me if I'm wrong. She has all of that data really like, she's great at remembering all of that. For me, it all starts getting very fuzzy. I just say for the most part, I remember starting this journey sometime around when I was 31, and I'm 38 now. So I feel like it spent pretty much my entire 30s going through this journey.
Yeah. Yeah. I mean, it's crazy how we're just not prepared for any of this, like at all. Like, you know, pregnancy loss, infertility, like there's no teaching, there's nothing, you know, and it's not like they need to not teach it. Like they could teach it. Like they teach us about, you know, car accidents and all these other horrific things. They could teach us about pregnancy loss. They could teach us about infertility and the risks and all those things. You know, but I think the education is just not there, even in terms of like women's health. We're only just starting to actually do the things to actually look into hormone health and like whether a period is normal or not. Like, you know, I was talking to Jill and she was saying, you know, she had really painful ones and she went on the pill, and, you know, because that's what they always tell you. Well, you have periods, go on a pill. And then later you realize, oh no, that's actually not normal. There's a reason for that. And it's just crazy. And also the fact that with the partner, you know, it takes quite a long time, I think, before they actually start testing the husband. And, you know, you'd think they test the husband at the same time as the wife, because if you're, you mean, it's a problem that you're both having, like, you know, you could both be involved in that issue. So, you know, you'd think they test you at the same time, but everyone I've spoken to, they're like, oh yeah, she went through testing first. And then, you know, after several failed, whatever it is, then they tested me. And it's like, it's confusing.
It is. There's a lack of education. There's a lack of training. How they treat women in healthcare is shameful. And I feel like there's almost like a subliminal blaming that's going on. Like, oh, it must be her fault, right? And so it's so problematic. And I can't even talk about it from personal experience. All I can do is say from the experience I have as being a partner and being a supporter is like, we have, my wife has tried to advocate for herself so many times, particularly going through the loss, particularly post the loss, and she just wasn't being listened to. And it was always like, oh, you're being dramatic. Oh, you're just blowing things out of proportion. I'll say this, she has an incredibly high tolerance for pain, discomfort. So when she's in pain, like when she's at a 5, I probably would be at a 10. So to just think that she's not being listened to by her care team is so frustrating as the partner, because you also want to get involved and advocate too, but it's like, you know, like, why is it that you're just not listening to her? This is her body. And why are you treating her pretty much like everyone else? You know, I know she probably talked about being sent out of the hospital with the same documentation you would leave with if you had a living child. But that wasn't the case. That's not the experience. So why aren't you giving her the tools she needs to know what to expect when she gets home? And then when she does get home and say, hey, I've never been pregnant before, but this doesn't feel right, to just blow her off. And it's true. I mean, just like you said, now I'm thinking about it, I didn't go for testing until later. It wasn't immediate that I went for testing. It's immediately the concern is, well, what's wrong with the female? It's like, well, that's not the case. I mean, it can be that there's 2 factors and there's nothing wrong really. It's just there are things that we need to address, right? And it can be 2-factor infertility, and that's exactly what our experience is.
Yeah, I've even heard where it's actually him that has the issue, and she's actually she's fine. Like the egg, there's eggs, there's quality, everything. And yeah, because they did all the testing on her and they exhausted those options. And then they were like, oh, okay, well, maybe bring your husband in.
After putting her through all of that, then I guess we'll bring him in. And can we just agree, by the way, that the testing that women go through is a little more invasive than the testing us guys have to go through? Because, and I say that facetiously, because it's a heck of a lot more intrusive than what we have to go through. So to quickly just determine whether or not there's a male factor issue, I mean, it's pretty easy. Let's just figure that out right off the bat, and then we can move on.
Yeah. I mean, for men, I mean, as far as I've sort of heard, mostly it's just like a sample, and then they take a good look.
Now, if they can't produce a sample, then yes, it's going to be far more invasive. But if they can produce a sample, then yeah, that seems like a pretty easy way to rule that out. Right.
Yeah. No, it's so true. And yeah, women, the things that I've heard test wise for women, I'm very grateful that I haven't had to do that. Especially like the ones where they have a look like in the, like to check for endometriosis and things. It's so full on, like a full on procedure and everything. It's very bad. So let's go into the experience that you guys had through losing Hadley.
So we had tried for a long time to get pregnant with Hadley, and I recall for that transfer, I wasn't allowed into the office because it was during COVID. So I think that was in September of 2020. So I had to sit in the parking garage and just hope that everything was going okay, kind of sit on FaceTime. And it was the first transfer that I forgot when the blood test was for the pregnancy test. It was just kind of a crazy time, and somehow I forgot. So all of a sudden I get a call, and it's my wife, and she says, "We're pregnant." I went, "Wait, what?" Like, I was blown out of the water. I was so excited. And when I got home that day, she had found out that it was a little girl, and she had a little onesie. She had the pregnancy test out as well. And I just remember crying with excitement. I was so excited. And I was so excited to be a dad, and then to find out that she was a little girl just made me so much even more excited. And it's funny because I've tried, like, Jill's asked me about that, and she says, "Was it just like you wanted a girl more than a boy?" I said, "No, I think in that moment she just became real, right? It wasn't a hypothetical embryo. She became a she, and she became my little girl." So I just remember being so excited about that. And for me, I was cool as a cucumber most of the pregnancy. I, again, was of the opinion, like, we're pregnant, this is going to be a living child, right? Again, another thing that we never talked about, we never heard about. So I remember not going to, because again, I wasn't allowed in because of COVID, but there was a 19-week anatomy scan, and she went in, and I was on FaceTime and watching, and I was just blown away by how beautiful she was, how gorgeous she looked, how perfect she looked, with my limited knowledge of what a fetus is supposed to look like. And I was just like really excited. The sonographer was very quiet, didn't really say anything, which seems like par for the course from what we hear. And then Jill said, "Okay, she left. She just has to get the doctor to sign off on a couple things, and the doctor will come in and talk with us." Okay. So I left, I went home, and I was waiting for a while, never really heard back. And I'm like, "What's going on?" So I text her, and she said, "I'm still waiting." Well, that's weird. So the next thing I do, I get a call, and she's just crying. And I'm like, "What is going on?" She says, "Something's wrong with our daughter's brain." I'm like, "Wait, what?" So we're trying to talk to the doctor through the phone as well. And the doctor's like, "Yeah, there's fluid on her brain, and he was being very brusque with her. He's being very unkind. And just really rash about how he was talking about her. And so he kind of flippantly said, like, "Hey, have you thought about terminating this pregnancy?" And I was like, "Whoa, hold your roll. Like, we're just hearing there's potentially something wrong with her brain. Let's get more information. Like, what does this mean?" "Well, it could be something mild, it could be moderate, it could be severe. This looks like it could potentially be severe." I'm like, okay, so what can we do? Like, let's go into testing mode, and luckily my wife is incredibly strong. She's like, I want to do the amnio. I'll do it right now. And she did the amniocentesis. And the doctor started referring to our daughter, and she didn't have a name at that point. But he kept on referring to her as an it and using past tense verbs when talking about her. So, what was she or what was it was one of the things that I remember him saying. And I was very triggered by that because I'm like, number one, it's a little girl. So, it's a she. So use that pronoun, at least for now. And then let's not refer to her in the past tense because she's very much here. She's present. She's in my wife's uterus right now. So let's not go that route. But he was very unkind in the way that he dealt with her. So I remember she came home. We spent the whole night just kind of crying and trying to figure out what our next move was. We knew we wanted to get another opinion. So we organized the next day to go to a hospital nearby that does a lot with maternal fetal care. And we're able to get in for an appointment later on that following week. So we went in, did the ultrasound, did the MRI, and it was a telehealth call with the team the next day, which is like the word. It's such a crappy thing to do, right? Like it's a crappy call to have, but then to not have that human interaction, person to person is just, so we sat there and they said, it looks pretty bad. It looks pretty severe. We think she has something called rhomboencephalosynapsis, ventriculomegaly, aqueductal stenosis, all of these things that really just mean that the hind part of her brain didn't form correctly and that there's a buildup of the cerebrospinal fluid, which is causing pressure on the brain, ultimately the brain stem, and tearing at the nerves. So it looks pretty bad. And we're like, okay, so what does that mean? And they said, well, it could be all of these different things, but take the weekend, think about the questions that you have, and we'll regroup next week. Okay. So we took that weekend and we came up with what we call our 20 questions, where we basically, if the answer to any one of these questions is yes, then we know that we probably would have to interrupt the pregnancy, because it was questions like, okay, if one of us quits our job, stays home, we downsize everything and just like care for her 24/7, get her all the care she needs, will that help at all? And they couldn't really give us any answers. They're like, well, it's a spectrum. It could be mild, moderate, or severe. Okay. So now you're telling me maybe 33.3% chance it's mild, moderate, or severe. So you're asking me to like gamble with our daughter's life like that. I was like, I feel like I need more information. And they couldn't answer the questions we had. And what's so difficult is so many of us in this circumstance are kind of left with the same result. There's only so much they can tell us. So we feel like it's almost a gamble sometimes. And it's so difficult. But I said, look, let's see if there's someone else we could talk to. So my mom ended up finding this doctor that specializes in fetal neurology, and called down there repeatedly, finally got in. I told him, look, we're on a tight deadline because under the law, we only have until 24 weeks gestation in Massachusetts before we could terminate, or within that time that we could terminate if we needed to. So we went down to this hospital. It was about 8-hour drive away. We went down and redid all of the scans, and they had us come into a conference room with a bunch of individuals there, with a geneticist who we just love. She's awesome. The doctor, who we love, that entire care team. They're just incredible individuals. And they all sat down with us and compassionately delivered the worst news that we could receive. But it was the way in which they did it that stands out in my mind, that still makes me love each and every one of them. And I still owe them a hug at some point in time. But they sat down and they told us that unequivocally, this is what your daughter has. She has all of those things that I just mentioned, that they were surprised she was still alive, that the fluid was slowly putting additional pressure on her brainstem. And we know that when there's enough pressure on the brainstem, that will cause the person to pass, right? And then they said, you know, if she were to be born alive, which was a big if to them, she would not recognize you, should never leave the hospital, should be in pain every moment of her life, should immediately go through surgery, none of which are going to help her. She's going to have uncontrollable epilepsy. She will not be able to eat, breathe, do anything on her own, and she will have a shortened life. And so this doctor looked at us and said, you know, you have two choices. And he says, you can bring her into this world, and all three of you will know pain for the rest of her days. Or you can do what we think you're probably going to have to do and make the decision to release her, interrupt the pregnancy, and you too will know pain the rest of your lives. You'll feel that, but she will only know love, and she'll only know that love from you, and she won't have to go through pain. So we knew what we needed to do. That trip home, we talked for 8 hours in circles, knowing exactly what we needed to do. And when we did get home, we decided we had to interrupt the pregnancy and release her. My wife was intent on, she wanted to go through induction and delivery. She wanted to go through the birthing experience. So we put that in motion. I went into planning of like, because again, what is it that I can do? So I tried to figure out what I could try to do to like be supportive and helpful in this process. So I created a birth plan for our daughter. We named her Hadley Maeve Atstupenas. And we put together this birth plan for her. So that way everyone in the hospital knew exactly what we wanted to have happen. Amazingly, you know, so we went on February 18th, 2021. She was born on February 19th, 2021 at 2:08 in the afternoon. And surprisingly, when she was born, I happened to look down and I saw her move, and I flagged the nurse and I said, I think she's alive. And they said, nah, I doubt it. It's probably just this and that. I said, no, I'm pretty sure she is. Like, take the little stethoscope thing and check. So they did. And sure enough, she was alive. So in that moment, she was placed right on Jill's chest. And I remember Jill kind of stroked her little cheek and she opened her mouth. And for me, I always tell people this, but like for me, when I found out that she wasn't going to live, one of the things I kept going back to was I was never going to feel my little girls like hold my hand or squeeze my finger. And that like crushed me. And so in that moment, when I saw her move, I put my finger in her hand and she squeezed it. And she squeezed my finger and she gave that to me. And that to me was the best gift in the world. And it just felt like that was her telling us, thank you, mom and dad. You made the right decision. I can be released now. I don't have to live in this pain. And she passed away shortly thereafter. So we spent we had this group come in, Now I Lay Me Down to Sleep, that does free photo shoots for bereaved parents in the hospital, which was absolutely amazing. And I'm sure my wife told you I didn't originally want pictures.
Yeah, she did.
Like, right? Okay. But as we get closer to that time, I was like, I definitely want pictures. And I was so glad that we do, because I mean, I have them on my phone. I'm looking at it right now. I'm looking at one of them. And I was so grateful for those pictures. And we spent the next 2 days just kind of being with her, trying to make a lifetime of memories in 48 hours. We read to her, we danced with her. We told the story of how her mom and I met. We swaddled her. We did all the things that we could to potentially like just make those memories. But you know, you're trying to cram in a lifetime of memories in 48 hours. There's only so much you can do. So in retrospect, I could have done this, I could have done that, but in the moment, it was just a matter of being in the moment with her. And that's in short our story of our sweet little girl. So
Yeah, and I know that it wasn't so peachy after you left the hospital with care.
no.
Especially with the lack of education that they gave to you guys when you left. But I do know she told me about how they had like a teardrop on the door, and there were certain things that there was care placed, you know, towards you guys, and for you to be able to have that time, because yeah, a lot of people don't get that time
No, they
with
don't.
a child. So I think
And there
that,
was no conversation about that, right? Like going in, there was no conversation about how long. And I mean, we even asked when we were in there, we're like, how long can we stay? And they're like, stay as long as you like. I don't know what that means. I don't know what that means. What I want to stay here for the rest of my life because I don't want to say bye to her. But I also know that there's only so long that you can be with them before things start to happen and maybe you shouldn't see them anymore. So where's that line? Like what is that? And when you're in this state, like that's when you need to hear this information. You need to be told this information, spoon-fed a little bit, because yeah, you're kind of just guessing. You're feeling around, hoping you're doing the right thing and not sure if you are.
yeah, I've heard, I mean, your wife mentioned the discoloration, and I think that's a lot of parents sort of mentioned that was the moment where they were like, okay, you know, it's time to say goodbye now. But yeah, I mean, I think you're one of the first ones who got that period of time, that length of time with your child, apart from the one that actually took their child home, which was a very shocking story. But also very beautiful. But yeah, very, very full on. It's a big thing to have done, and to experience and to bring into their home, because obviously now their home is filled with that
Sure.
memory.
Yeah.
So how was it for you leaving the hospital?
That was one of the hardest moments. Building up to that leaving time was so hard. It was like, I think we just kept trying to rationalize the fact that we had to leave, trying to almost give ourselves like a pep talk to be like, we can do this. And then also, when's the last time I'm gonna hold Hadley again? When's the last time I'm gonna kiss her? When's the last time I'm gonna read to her? When's the last time I'm gonna do all of these things? So it was very much like repeating the last things as many times as I could before I actually finally had to leave. And it was so tough to do. But I asked for like universe, give me a sign that I'm supposed to leave. Like give me some sort of push, because this is impossible to leave her. And for us, the nurse that was the very first nurse that took us in on day one, she happened to come back that last day, and she walked in and we knew. We're like, we really just had a great resonance with her. She was an awesome person, and we knew that she was the one that would be able to help us leave that day. And so we told her what our plan was. And we said, we feel comfortable leaving our daughter with you, knowing that she'll be safe with you. She'll, you'll take good care of her. And she said, no, by the end of my shift, I'll make sure that you guys, will be on your way home, and I'll make sure I help you through that process. Leaving the hospital was difficult, because my wife was being wheeled out in a wheelchair, and she had a box of like these, they give you a box. This particular hospital gave us a box for like little things that we got during the process as like a memory box. And as we left, I remember there was somebody that worked on the staff that said, oh, congratulations to us. And I was like very confused. I'm like, you do see we have a box, right? Not a baby. It's like the parents leaving without the babies are the ones that get the boxes. These are not happy boxes, right? This isn't a present. And I just remember that being difficult for me as the partner. I remember too being there and having this orange bracelet they gave me so I could keep on accessing the floor. And so every time I left, I would see people in the hospital and it'd be like, oh, congratulations, thinking I was there for, delivery, which I was, but I wasn't bringing my daughter home. And it was just so difficult seeing those people over and over again who were congratulating me. And I'm like, I feel like, I don't know, can you give me a different wristband color or something that just says, leave me alone, don't talk to me, just like, or be very kind and gentle with me, because this is not a happy time. But getting home was difficult. It was, as soon as we got home, we're looking at each other like, what do we do? My wife was very much like, she felt like, and I don't want to put words in her mouth, but I think she felt like because she didn't bring home a living child, that she didn't also have to care for herself, that she didn't go through labor and delivery. And so she wanted to just like go to Home Depot with me and go here and there. And I was like, I think you should lay down. I think you should. She's like, well, I said, you did go through labor and delivery. Like I saw what you went through. And I also remember seeing her go through, after she had gone through labor and delivery, they did a D&C on her while she was wide awake. And I remember the face on her. It reminded me of the final scene of Braveheart where he's being eviscerated, just the face she was making. I'm like, I know you have an incredibly strong pain threshold, but the face I would have died. I would not have made it through something like that. So I really feel like you should honor yourself and take care of yourself. So some of it became like, okay, make sure I take care of her, right? Go into that care mode. But then it was also like, okay, we have to plan something for her service. So instead of me focusing on my grief at that process, I was all focused on like, focus on her because I was concerned about her. I knew when we left that hospital, I wasn't leaving with our daughter. I was scared that something might happen to my wife as well. So I was like, just take care of her and then make sure you can give, we can give our little girl a nice memorial service that will memorialize the happiness she brings in our life and how important she is for us. And that's really what I did. I went into just like planning mode, just keep busy, keep planning, focus on doing stuff. And as a result, just kind of repress your emotions, repress your own grief process and just stay busy.
Yeah, I think that's what a lot of people do. And Jill actually said that she didn't even think about it. It wasn't even something that crossed her mind. It wasn't like, oh, I'm gonna just, it was just, oh yeah, that happened, and now I'm doing this. Like I'm doing things. And that is often the case. Like I can vouch for that. Like you go through a thing, an ordeal, you deliver something, and then you're like, okay, cool. So all right, that's over.
It does not surprise me. It's just like, okay, yeah, that's over. Let's move on. Like, really? Okay. Like, I feel like I need time from watching what happened, but it's like, I can't imagine what you're feeling, but
yeah. No, and I think it does take the partner to, be like, no, you need to rest. Like you're the voice of reason. We don't really, we're very, well, it'll be all right. We're alive. But yeah, I mean, you witness what we go through, and I think when you're going through it, it's very easy to kind of detach or kind of be a part removed from that experience. Although you've been through it, there's like that little detachment that kind of you're like, oh, I've done that now.
It's amazing.
Yeah, not thinking about, okay, well, my body has to recover now because it was 6 months of whatever it was, and then now I have to go through at least 6 months to recover, right?
Yeah, you focus on the growing period, right? You focus on how much change occurs during that 6 months, and you're like, okay, tomorrow, why am I not able to go run?
Yeah.
I don't know, because look at everything your body's gone through. Like there's trauma associated with the growing of this child, right? With pregnancy, but then the trauma that you went through of whether you did a D&E, D&C, induction and delivery, regardless of how you went about that process, that's an incredibly traumatic process on your body as well. That deserves and honors to be respected. And you should certainly care for yourself and relax a little bit. So, yeah.
Yeah. So, how has that been? I mean, I know like as the husband, you're just kind of watching this, and I know sometimes you can feel a bit helpless, right? So it sounds like you got a little bit frustrated, like about her not sort of taking it seriously, because I know she was like, oh, but I want to spend the day with my brother.
Oh,
so
yes.
I want to do that. And you're like, okay, well, if you still feel bad in the morning, we're going to take you to a clinic, you know? So yeah, what were the feelings, and how did you sort of move through and like try and be okay about whatever it was she was going to do?
So, like, as the guy, I don't know what she's going through physically. Like, I have no idea. I can only assume, and I can. So a large part of it was just intuition, and also just checking in with her, because I know what her normal is. All right. I know what, and I don't want to say normal. I know what her status quo is from a physical perspective, like when she's feeling okay. And I could tell she wasn't feeling okay. And I could also just feel like it was getting worse, not better. And I was like, I don't know much about recovery after pregnancy, but I do know, generally speaking, with recovery, that you tend to get better over time, not worse. Just, I mean,
yeah,
I don't know, intuition, common sense, whatever you want to call it. It just seemed like this doesn't seem to be going in the right way. It seems to be tracking in a bad way. So yeah, I tried to have those communications with her. What's great is we've both been really good communicators. We've only gotten better over the course of this loss, and certainly, you know, seeing a therapist together has been helpful with that communication as well. But just communicating like, hey, I really think you should reach out to your care team. And then unfortunately, the care team dropped the ball and was like, yeah, you're fine. I'm like, okay, is it just me? Like, I really feel like there's something wrong. And it finally, the straw that broke, you know, that was like the final straw was, I remember I just left to go get takeout from this really good Mexican place down the road. So I got back and we had this big feast we were going to eat and whatnot. And she had one bite of beans and she's like, I can't eat anymore. It's like, wait, what? I said, you can't eat anything. She goes, no. I said, why can't you eat? She says, it hurts so much. I'm like, okay, it's not like bad food. It's your abdominal area is in pain. Yes. What's it feel like? Well, it feels like it's on fire. That seems bad. Again, I don't own a uterus. You do. I appreciate that. I don't have the same anatomy, but I'm thinking one bite of food, like 2 weeks after the delivery, should not equal fire, or should not equal like that amount of pain in your stomach. So yeah, there was a little bit of negotiation. I told her, if you're not feeling better by tomorrow morning, we're going to go in and go to urgent care. And I was very thankful that we went that route eventually, because yeah, she had retained placenta. Unfortunately, still during COVID. So it's at the end of the day, visiting hours are over. So they kick me out of the hospital and they say, hey, we'll reach out to you after the surgery's done. I'm like, okay, well, give me more specifics. Here's my phone number. Who's the doctor that's doing it? Okay, same doctor that delivered. I know her. Great. Okay. When will I expect a call? Well, about like 45 minutes. Cool. I will be home ready, waiting for a call. I was like, and you sure I can't stay here? No. Okay. So went home. I waited for the call, and it was like an hour and a half later, no call. All right. That was like 10:30 at night. Hospital's closed. So I just called the switchboard and I'm like, this is the situation. I need to know, where is my wife? Is she okay? And I have not received a call from the doctor yet. Luckily, they put me in touch with the recovery nurse, who told me, yeah, she's here. She's recovering. And, she's doing okay. She lost a little blood, they said, little blood. And then they said, the doctor got tied up with something else. Are you going to be able to stay up and we'll have them call you? I said, no, understand this. I will stay up all night if I need to. I need a call from the doctor who did the surgery, just so I know what's going on. So finally got that call around midnight. And again, I'm told she lost some blood, but now it's not a little, now it's some. Okay. So we get there the next day. She's now back on labor and delivery on that floor. And which is both a blessing and a curse, because that floor is just so triggering to be on. And for me, just the hospital alone, one of the triggers of being in there is the smell of like the hospital sheets. That's like what Hadley was wrapped in. So it reminds me of her. It smells like her. So part of me loves being in a hospital, and part of me is like, oh my goodness, I don't want to be here. But that's when we found out when I got there and talked to the doctors that she had actually hemorrhaged during the operation. Not enough that she needed a transfusion, but it was far more severe than what they were letting on the night before. So there's a lot of frustration there, right? Again, I'm afraid of what's going to happen to my partner. I've already lost my daughter. I can't also lose my partner. And it was prime example of they just weren't focusing on paying attention to what she was telling them all along. So from the partner's perspective, what I took from that is no matter what, we need to advocate for ourselves because our doctors are not going to do it. Sometimes they will, and that's great, but always rely on your own instincts and rely on your gut and be sure to advocate for yourself because sometimes people drop the ball.
Yeah. Yeah. Before we wrap it up, how did you sort of go and like, I mean, there's no such thing as normal. And I don't want to say new normal because new normal just irritates me because of the whole COVID thing. So
Right.
I'm not going to go there, but how was it sort of transitioning back to reality? I don't know. The people, I don't know.
It's so tough, right? It's so tough. I love that you don't call it the new normal for that reason. That's perfect, Ellen. I love that. Yeah, COVID stole that, so we can't call that.
Yeah.
I completely agree. So yeah, there's no normal, like this Eric is very much a different version, right? I'm still trying to figure him out. He's a very different person than what I knew 2 years ago. What's been incredibly helpful in our grief process is finding community with one another. You know, the how amazing is it that you and I can have this conversation right now? We've never met each other, right? Apart from one Instagram message and now sitting and chatting and feeling this connection, feeling a sense of community with someone just because of a common loss and a common experience. And how amazing that is that we can find that with one another. That, you know, it's such a crappy club to be a member of, but it's such a beautiful club to have when you need it, right? To have this community. So for me, I didn't take much time out initially to pay attention to myself, to really focus on myself. I focused more on like keeping busy, doing projects. I wanted to like do all these different things because I figured just head down, keep processing and doing stuff and I'll be fine. And then about 6 months out, that's when my world just kind of started collapsing. And that's when I really needed some help. I found myself in a real dark space. And I felt like, oh my goodness, it's 6 months. How am I here? I should be somewhere else. I should be, you know, feeling much better right now. And I'm not. And that's the experience of so many of us guys and partners is that like we spend so much time being the support at the beginning that we just kind of put aside our own grief process. And all of a sudden, 6 months out, when our partners are starting to feel a little bit better, right? They're starting to feel a little bit better. All of a sudden we're like, wait a second, I'm not feeling good now. And that's where I kind of needed to take some time for myself. So at that point, I did a lot of work with my own. Therapy has been very, very important to our journey. And, you know, not just with loss and infertility, but just growing together as a couple and growing together as partners. And then we do a lot of work now with Empty Arms Bereavement Support, which is a small nonprofit out in Northampton, Massachusetts, that services all sorts of bereaved parents across. I don't want to limit it to Massachusetts because we have bereaved parents now across the world, particularly in the TFMR community, because there aren't a lot of resources for so many parents that do have to terminate for medical reasons. And it's been really helpful working with those groups. I joined up a dad's group early on. I've been a member of that dad's group or an attendee at that dad's group for a couple of years now. And actually the end of last year, I was actually asked to be a group facilitator for that group. So I actually just started doing that beginning of this year with my co-facilitator, who's an awesome gentleman. And he and I get together with groups of dads every 2 weeks, I'll say, and we get to have these conversations. We get to talk about the male perspective of going through infertility, of being the support partner, and also talking about all of the things that we don't normally process, right? Like, you know, a lot of us are taught from young men to just repress our emotions or put them aside, and boys don't cry and all that other crap. But we do cry, and it provides us a good time to get together and express those emotions and talk about these things. And just, it's real talk. And that's what we need in life. We need people that can see us for where we are in our grief journey and support us, and not push us to be somebody we no longer are, or to push us to be somebody that we're not. To just honor us for who we are, respect us, and be gentle with us, because that's what we are. Although I'm 38, I feel like I'm 2, because it's been 2 years since our grief journey, and I feel like as a 2-year-old, I'm trying to figure out who this new person is. So give me a little time. Let me figure me out before you start telling me what I should be. So that's kind of how the process has been, very, very briefly.
Yeah, I mean, it sounds like you're giving yourself a lot of grace and a lot of space now. I know it can be just really surreal. A lot of people go through that period of time where they sort of, even women as well, where they just kind of get on with life, and like they're doing things, and then they're like, oh, this is grief. Oh my gosh, this is still here. Like like it's something, they'd missed that step, like they just leapt towards just accepting everything. And it really is amazing how if we don't actively deal with it, like we don't actively move through it, it catches up with us anyway, comes and gets us.
Absolutely.
Yeah, and something I've been learning is just that it's a process, and it's a forever thing. Like it's the rest of our lives. We're going to feel this grief, we're going to feel this loss, and we're going to miss and long for our child sometimes, and that's okay. And we're going to think on them, sporadically, maybe every day. Like I've heard some guys say literally every single day, they think. So I think, yeah, we just have to have that grace. And I'm so glad that you are giving yourself that, and allowing yourself to feel that, and facilitating those groups. Are you part of like the Sad Dads one?
So I'm relatively new there. I've joined their Instagram, and I've certainly been looking forward to doing they have open hours twice a month, I believe. So I plan on joining them very shortly for the next one. I was actually on another podcast recently with the guys in grief, who are awesome guys as well. So that's another good resource for all of fellow lost dads out there. And yeah, to the extent that you can find communities like this, absolutely join in. I've heard great things about Sad Dads Club, where you can just go right in and share with guys from all across the country, or maybe even across the world. And so it's really, really a powerful experience to tap into that, to be able to talk with other guys, to see like, oh, I'm not going crazy, right? Like what I'm feeling is normal. And I think you articulated perfect, Ellen. Like this is something we carry the rest of our lives. So like honor that, respect that, and also take the time to pay attention to when you may be experiencing grief, but not realizing it. Like if you're angry, for instance, is it really anger, or is it sadness? Is it just a moment that you're being triggered? And take that time to look at it, figure out the root of it, and pay attention to it now. Because if not, it will come back later on.
Hi.
Hello.
I live on an off-grid farm.
Sure. Cool.
The power went off. It's okay. Zoom actually, that's why I use Zoom, because it actually like automatically saves the video.
Oh, perfect. There you go.
It's amazing. But
I was just laughing. I'm like, just as we're wrapping up, I think that was perfect.
Yeah, it was. I was like, oh, at least he finished his sentence,
That's fine.
If we have to end it there, we can totally do that.
I guess so, right?
But yeah, usually I ask, is there anything that you would want to say to anyone who's like in the throes of it right now? Maybe they're going through a loss, maybe they had to sort of go through the same or similar thing as you guys did. Sure. Is there anything that you'd want to sort of say to them now?
I would say I'm so sorry that you're here, that you find yourself in this situation, because this is nothing that any of us thought we'd be going through. And I feel how betrayed you feel, how angry you feel, how sad you are. And all of those are super valid emotions. Don't let somebody else tell you what you should be feeling. Don't let somebody tell you that you should not be as sad as you are, or as angry or as upset as you are, because the reality of the situation is that you've worked so hard to bring home this living child, to bring home this child, you've done all that you can possibly do, and it's not fair. And there's nothing that you could have done differently. There's nothing that that could have changed anything. Unfortunately, so much of this is out of our hands. And so while you may be feeling some blame, you may be feeling like this is somehow your fault, it's not your fault. And to the extent that you can, please be gentle with yourself. Treat yourself kindly. Use this opportunity to parent yourself the way that you anticipated and planned on parenting your child. Because a large part of it's going to come down to, and a large part of the healing process is going to come down to those same abilities that are innate within you as a parent, that unfortunately, although you don't get to parent that child, you do have to parent yourself and take care of yourself and advocate for yourself. So when you're doing so, figure out what makes sense for you. I've said before, be gentle with yourself and surround yourself with people who will be helpful on your grief journey, who will honor you for where you are in your journey, who will support you, and continue to communicate. If you are in a partnership, continue to communicate with your partner. If you find that if you're not in a partnership, communicate with your friends, with your families, with the loved ones that are around you who can support you. And know that at the end of the day, you are not alone, even though it feels like it right now. And I understand. It feels like the darkness is all around you and you can't see anybody around you. But that little light in front of you is going to grow a little bit stronger and stronger every day and push that darkness back just a little bit more each time. And as it does, you're going to start to see the support and love that surrounds you. Know that you're not alone and that you matter. And please continue to reach out to the amazing people on Instagram, in your support network, wherever you find a sense of community, to know that you're not alone and to find that support. And much love to all of you, and deep gratitude for you, Ella, for holding the space and creating the space, and for allowing us to get together and talk about these oft not mentioned and oft not talked about issues. So thank you so much.
Thank you. And thank you for being here, because honestly, this would all be for nothing if I didn't have people being willing to share what they've gone through and to be vulnerable in that way, to experience their emotions if that's what they have to do, or laugh about something that may be inappropriate to laugh about. So thank you so much for joining me and being a speaker on this event. I will be sending you guys a link to the live schedule and everything, so you guys can be part of that if you would like to be. It's just going to be a few different chats and things where we're kind of just going to talk things through, like the lack of things that are in this space, like with the medical professionals and so on. Hopefully it won't turn into one of those things where we just moan about them all the time. But no guarantees. So
hey, what happens, right? So, no, that sounds great. Thank you so much.
Thank you so much. Enjoy the rest of your day.
Thanks. You as well. Take care.
Bye.
Bye.
Please note that all speakers, including experts and professionals, express information, views, and opinions that should not be used to diagnose, treat, cure, or prevent any medical conditions. If you have a medical issue, please consult a qualified professional. Speakers voice their own views, opinions, and conclusions, and they may not reflect the views, opinions, and conclusions of other speakers. Ella Rose, The Joy of Sunflowers, and its sponsors may not endorse all or any of the views, opinions, or conclusions expressed.